This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. Did you know that the brain controls and regulates the health of your entire body? This is Dr. Tom Roselle. Think about this. When the brain-body's life force is blocked, physical symptoms begin. What if you knew how to prevent the deterioration of your brain-body system, avoiding chronic pain, dementia, Parkinson's, MS, and immune dysfunction? Join me on Saturday, October 17th, and I will teach you how to restore normal brain-body function. So what are you waiting for? Go to agelesshealth2015.com or call 703-698-7117.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
And welcome to Dr. Tom Roselle Live. We are here in studio taking your questions on how you've tried and applied with the healthcare problems that you have and have not gotten the answers that you like. And sitting in for Dr. Roselle is myself, Stephanie Pina, and I have a guest here that we're going to be going over a very good topic today, and that's going to be Dr. Matthew Adams, and we're going to be talking about the natural approach to scoliosis, something that many of you may have think of as only an adult, or I should say an adolescent condition or with children, but we're going to talk about how that affects us when we get older as well, too. Dr. Adams, welcome back.
Thank you.
We're taking over again.
Yep. Again, except you're the one in charge and I'm over here.
Exactly. We tend to have to go back and forth. So this time I get to grill you on the spot.
Go for it.
So we're going to talk about scoliosis today and get some information because that is going to be the topic for this Wednesday's lecture that's coming up at our office at the Roselle Center for Healing in Fairfax, Virginia. And that's going to be on Wednesday, October 14th at 7:30 p.m. And if you want to reserve your seat for this, you got to give the office a call. That number is going to be 703-698-7117 for basically to reserve your spot for 7:30 for Dr. Adams' scoliosis lecture. And as we'll get into later, you can also sign up as you got 1 week left to sign up for Ageless Health, and you get to hear both of us speak next Saturday. We'll talk more about that later.
Yeah.
But you can sign up there, and I believe they're honoring that you can also sign up online, and if you're in the office itself. So if you come in and you see Dr. Adams present, you're like, wow, I want to see him present another topic. You can even sign up online when you're in the office.
There you go. Wow.
So scoliosis. Let's talk about the spine and the curvatures and how things are normal and not normal and what we can do overall for that.
Yeah, scoliosis. People think that I don't know. Whenever you get like a title, you automatically think you have a disease and there's nothing you can do about it. I've got scoliosis, so I've got it. And unfortunately, that's the wrong mindset. But at the same time, a lot of people have scoliosis. It's not necessarily something that you're going to correct and get absolutely straight at the same time, because you've got a pretty good curvature. Some people do at least. And a lot of times that's your body's way of adapting to whatever is going on, trying to help it work better. And so the things that I like to look at and discuss is, one, how are we developing this? How are we getting it worse? And what can we do to help ourselves feel better and prevent it from escalating into something more major to where you have to have surgery?
So let's talk about for a second. Let's backtrack and talk about the spine.
All right.
Before we get to the negative stuff about all the bad things that can happen, why do we have curvatures in our spine to begin with?
Well, we have curvatures kind of going to the front and back. We call a C-shaped curve. That's what causes you have a little curve in your neck, and you look at someone's back from the side, you can see a little curve down there. So those curves are necessary, kind of like a shock absorber with the joint. So when you walk, it takes off some of the pressure and has some spring. At the same time, that spring allows the joints to move and allows the pumping motion on the discs so that they can get fluid in those discs in between the joints. So there's a whole important process going on. Plus, how the muscles connect to the pelvis and the legs and all that stuff. So it keeps us upright. So that's the basis right there. So scoliosis is whenever that curve is to the side. So if you look at somebody from behind and you notice that their spine is shifted, or you notice that one shoulder is a lot higher than the other, that's when you have a scoliosis. And the curve to the side is not what you want. You want the front curve when you look at somebody from the side and you see they have some curving there, but you don't want the sideways one. We
know that as we age and develop, even as a child, and before basically birth and on, that's when those curves start to really form, because then our weight starts to change and our body obviously starts to change. So from the time we're going to lift our head up and move around and see what's ahead of us and start to crawl, the first curvature is starting. And then when we're getting up and actually walking, we have to be able to distribute that weight differently. So the body will form those different curvatures based off of that.
Mm-hmm. That's why tummy time is so important for babies.
There you go.
Get their head up. My daughter had a really big head, so tummy time was hard for her. we made it happen. But yeah, so you need those so we can stand upright. But the sideways curve, that's when we start having problems and pain over time from that sideways curve. And a lot of times you'll start seeing it with children between ages 10 and 12 is the most common area. And that's important to figure out or find early, because the longer they have it, the more that curve can start to increase. You don't want it to get too far over, because then when the spine starts curving to the side, it can put pressure on different organs in the body. And so that's not a good thing.
Also, I remember being basically in junior high school, so about that same time, and they would come into our gym class and they would do testing to really look to see how kids were developing. Not only how could they run and throw and stuff like that, but they would do an examination almost to kind of see which students they need to pull aside that possibly might have an issue with scoliosis or developing properly and stuff too, which I found out the name of that coincidentally happens to be Adams testing, is when they were bending you forward and kind of seeing how they're basically the spine stacked back up straight or not, or if it was going to one side or the other.
Yeah, they're trying to test early and catch it so they can let parents know. And there's different techniques that the medical field uses with bracing. They put braces on there to try to straighten it. And then sometimes they go and they do surgery, which I guess sometimes you have to have that surgery, but for the most part, I think if you can take a conservative approach, what they do is they basically take these two rods, really long rods, and it goes most of the length of your back, well, maybe half the length of your back, and they fit these rods in there and put all these screws around the spine on either side to try to hold the spine straight. And they do it a lot of times at the age of your teenager. And so to hold everything together, the problem I've seen with that over time is anytime you hold one joint in place, the other ones start moving more. So because you lose that natural curve with the shock absorbing. So now the other joints are like, oh, these are stuck, so I got to take all the load. And so that's when you get a lot of pain. I've had patients with those rods coming in with all kinds of lower back pain and neck pain because of the rods put in their back.
So literally you're stuck in one place because there isn't any kind of direction that you can go, because that spine can't move and shift the way it should normally.
Yeah, exactly. Yeah, it's stuck in place. And so the idea behind what we do in chiropractic and with nutrition and things like that is to be able to get the joints to work a little bit better, get the muscles around the spine to activate a little bit better, which will keep the spine from shifting over. Now, granted, not everybody can avoid that, but a lot of people don't know that there's other approaches that they can take in order to strengthen the muscles around the spine and keep it from falling over sideways, keep gravity from constantly winning and taking over their spine.
So that's going to be one of the many things you're going to be talking to about on Wednesday night as well, too, and all the different natural approaches and kind of understanding where these curvatures are coming from, lateral and all sorts of things.
Yeah, that and talking about, we can even talk about the things that we do to ourselves that cause these things. Like I talk to a lot of people about, men who sit on their wallets. You're sitting in your car, you're sitting on your wallet all the time, and that pushes one side of your hip up, well, your spine is going to bend a little bit. Or moms holding their kids on their hip. You know, you do that long enough, your body adapts, and now your hips shift and your spine goes with it and starts to curve. And so they call scoliosis, the most common is called idiopathic scoliosis, and that basically means they don't know what causes it. But yeah, I mean, you can't necessarily pick out, it was this event that caused my scoliosis, but could holding the phone with your neck for 20 years at an office cause a curvature in your neck? Probably. So is it really idiopathic, or can we look at some of the history and go, okay, I can see that you were doing this every day for this long. It probably was this causing that curvature.
Right. We start to see the environment's influence on us.
Yeah.
Versus just it's a genetic thing, or or there was a trauma or incident. But our wear and tear that we see, even with other injuries like carpal tunnel syndrome, different types of low back pain as well too. So it's kind of falling a little bit into that. We're going to be taking your questions here live on air. It's the number to call in is 1-888-360-9625 if you have a question about scoliosis or anything else. And in fact, we're going to answer a question right now. John, how can we help you?
Yes, good afternoon.
Good afternoon.
Good afternoon.
Yeah, how are you doing, guys?
Doing.
Great show.
Thank you.
My question is about natural cures for ED or partial ED.
Well, so natural cures for that's kind of a broad question. I did a talk on that, and I was on the radio with Dr. Roselle a while back. So you could actually probably find that Dr. Tom Roselle live, and we had to do a whole segment on it.
How far back?
That was this year, I believe, early in the year.
Yeah, it was earlier this year.
Is the podcast still available, you think?
Yeah, oh yeah. You can go to Dr. Tom Roselle Live and find it. Also, the YouTube channel, if you Google Dr. Tom Roselle Live and, I think it was called...
I think that's a Uniquely Male lecture.
Yeah, Uniquely Male. You can find there our Dr. Matt Adams. But the thing with that, with erectile dysfunction, a lot of it has to do with sometimes blood flow. Which is important, and if you've got that problem, usually you've got a blood flow issue somewhere else before it starts there. So you usually have to work on, okay, what's my blood pressure, my cholesterol, what's the plaquing like in the arteries, because you really want to be careful with a heart condition and work towards that, and that's what you need to figure out before you go necessarily straight at like ED. Now, there are some different herbs you can take, things like niacin that help with vasodilation, but it's usually a sign that there's something else going on. The same with if your testosterone's low, that's going to affect it. But again, testosterone just doesn't go low by itself. There's usually a combination of other hormone changes that have taken place, either from estrogen, too much estrogen, or adrenal fatigue that you have to work with. So that's my approach to ED is trying to work your way down the line and say, okay, where's the breakdown in regards to blood flow? Where's the breakdown in regards to causing hormone problems? And start fixing that and letting the body heal. And that is what eventually allows things like ED to start to go away.
I think what else is interesting that kind of ties back into what we're talking about too with, the curvatures of the spine, especially in the lumbar spine, is that's where those nerves are kind of coming out, not only to go to different organ systems, but also to the reproductive system for men and women.
Yeah.
So sometimes if there's issues going on with the spine, it's not getting the electrical signals, it's not getting the chemical signals like the testosterone, but it's also not getting the circulation that it needs to basically function properly for men and women.
Yeah, exactly.
So scoliosis is the topic for today. If you want to call in and join us, you can call, like I said, 1-888-630-9625. And this is going to be the topic for this Wednesday night, the precursor to Ageless Health, on October 14th. And you can call the office to set up an appointment and come in and see Dr. Adams, ask your questions, and kind of see how this is all interconnected together. We got a couple of seconds before we go to break, but Dr. Adams, why do you think scoliosis is just, we can leave into the next section too, but why do you think it's such an issue with children and adults, and why they diagnose them but not, or children and not diagnosing in adults?
I have a good answer for you when we get back.
Okay, that sounds good. We'll have to hold on for that one.
Did you know that the brain controls and regulates the health of your entire body? This is Dr. Tom Roselle. Think about this. When the brain-body's life force is blocked, physical symptoms begin. What if you knew how to prevent the deterioration of your brain-body system, avoiding chronic pain, dementia, Parkinson's, MS, and immune dysfunction? Join me on Saturday, October 17th, and I will teach you how to restore normal brain-body function. So what are you waiting for? Go to AgelessHealth2015.com or call 703-698-7117. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
And welcome back to Dr. Tom Roselle Live. We are in studio and filling in for Dr. Roselle as he is out educating the public once again. And as you heard on the commercial, the education just keeps continuing at Ageless Health 2015, where I always think is interesting is it's an informative day for myself as well, because all the presentations, we might be familiar with the topic, but we've never heard them presented before because we change it up every single year. And this year is the brain-body focus, and both myself, Stephanie Pina, and Dr. Adams will be speaking. I think we're both in the morning, too.
Yeah, we are both before lunch.
Before lunch, and I think yours even ties into the lunch talks, but...
Kind of. Mine talks about the gut-brain connection, so, hopefully after talking about the intestinal tract before lunch won't deter people from eating lunch.
Well, usually we have Sue Roselle talking about nutrition right before, so then everybody goes to lunch and they're very conscious of what they eat. So
yes.
we give them a nice, organic, healthy meal so that they don't have to worry about running into Sue and Dr. Roselle and going, oh my God, I just ate this and here I am at this lecture. So
yeah,
that's all planned.
She'll make you accountable, but it's a good thing. I think that's the biggest part of it is, one, you might feel accountable, you might feel kind of bad about some of the choices you're making, but you feel motivated.
There you go.
To make a change, and I think that's the biggest part of Ageless Health is that fact where you come out going, okay, I can do this. I can make a change. So
you've got the support.
Yeah.
You've learned what the connection is. Now you can go forward and make that change that's going to make, sometimes a bigger change that next day and then continue to make changes afterwards as well. So, yeah, I have the brain on fire. When Dr. Roselle first gave me that lecture, I said, that's interesting. I don't know what I'm going to do with that. But we're going to talk about how acupuncture stimulates normal brain function. And some of the other topics, in case you're wondering, we have psychoneuroimmunology. Dr. Lamp's going to be talking about that one. The effect of the immune system on the brain. We also have, like I said, Sue's going to be talking about nutrition. And we're going to have an added-on guest speaker, Dr. Howard Cohen, who's going to talk about how alkalinity can restore brain function and stop the deterioration of brain issues. So it's going to be a good lineup. If you haven't signed up, or you haven't come before, but you listen to the show a lot, this is a great way to see us in person, ask us some questions. Dr. Roselle speaks at the beginning and at the end, and we're around all day, so we answer questions right from the audience. And
you get fed.
Yeah, and you get fed.
And it's a good meal, too.
So you can either sign up online. You can go to our website, which will lead you over, rosellecare.com, ROSELLECARE.com. You can sign up, or sign up by basically calling in our office to also sign up for Wednesday's lecture at 703-698-7117. And you can also sign up online, up through, I think the day of. So $99 will get you a full day. It's from 8 to 5. I think they start exercises at 7, so you can get your blood pumping and moving.
They're doing some Tai Chi.
That's right. There's usually a Tai Chi demonstration at lunch, too. Mm-hmm. So before anything goes on, you're going to answer the question that we left everybody waiting for. Why do we see this more diagnosed scoliosis in adolescents versus adults?
I think one is because they screen for it, which you mentioned. A lot of times they do that. And so they're going to try to catch it early because the longer – we know when your spine is out of alignment and you have forces on the spine that are not where they're supposed to be, that causes your disc to push over to the side. It causes rubbing on the joints and then leads to degeneration and bone spurs and things like that. So you want to catch it early with kids so you can work towards correcting it, and so that by the time they get older, they've built up the strength to hold things in place and be able to function normally. Adults, there's not a lot of screening, and they don't come in until they're in pain. And then I'll have patients come in, they've had back pain for a while, never really seen anybody about it, and we take an x-ray. I'm like, oh, okay, well, your spine's curving to the left. Anybody told you that? No. And so now they've got some degeneration built up, and they've got, like I said, some bone spurs. Their discs are dehydrating, or they've got some disc pushing out, pinching on nerves. And so that's when you usually catch with adults. So if you can find it earlier, that's better. That's not to say you can't help an adult who's built up a scoliosis over time and has a lot of problems too.
And I think one of the things that's interesting as well when we look at this is, and you mentioned, like, it's not just looking at the spine too. Sometimes we're seeing different shoulder heights. We're seeing people kind of walk differently because it's also affecting their pelvis, so they might have different leg lengths. You might, and maybe someone coming in, worried about their appearance and going, I don't understand why things are just off, or one shoe rubs differently the other way, or
yeah.
I have pain on one side or another, and you're seeing there's reasons, but it's that underlying structure as well that
Definitely.
we have to look at. So yes. And then we also have to think about some of the other muscles on each side too, which I think we're going to get into more in the second half, but we got the spine itself and then the muscles around it and all the connective tissue in between.
Stay tuned.
Yes, we'll be back in just a little bit. Thanks.
You've been everywhere, you've done everything, and you still feel like, well, Did you know that your health and wellness starts with your brain and nervous system? What if by establishing normal brain and nervous system function, you could regain your energy, strength, and vitality? Would you be interested? I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me and an elite group of wellness practitioners for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that could change your life forever. A day when you'll learn step by step how to create a brain-body connection that will allow you to live in a state of wellness that you deserve. Register today at agelesshealth2015.com. That's agelesshealth2015.com. Or call 703-698-7117. Register today. After all, your health is a do-it-yourself program.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And welcome back from Dr. Tom Roselle Live. This is In Studio. We are live taking your questions and talking about the natural approaches to scoliosis. This is Stephanie Pina and Dr. Matthew Adams sitting in for Dr. Roselle today. And the amazing thing is this Wednesday night, you can get a preview of Ageless Health, one of the Ageless Health speakers, by coming to the lecture on the natural approaches of scoliosis. That's going to be October the 14th at 7:30 p.m. at the Roselle Center for Healing in Fairfax, Virginia. Fairfax, Virginia.
8550 Arlington Boulevard, Fairfax, Virginia.
Suite 325. If you want to sign up for this, you got to give us a call to reserve your spot. That number is going to be 703-698-7117. Tell them you want to listen to Dr. Matthew Adams talking about scoliosis. And then you can also sign up for Ageless Health too and visit us on the weekend. There's a few spots left, so you better get yours now. All day. Scoliosis. Back to it. One of the things that we were talking about over the break, which I think is very interesting because we think of scoliosis and this irregular curvature of the spine as being just a spinal issue, but we know there are surrounding structures to that as well too. And obviously the spine is really there just to protect the spinal cord is one of the main functions, but then there's a lot of nervous connective tissue on either side. There's lots of muscles that help us move as well too. We definitely have to take those into consideration when you're trying to basically retrain the spine.
Yeah, so if you have muscles, because you have muscles on both sides of the spine, obviously, to help you stay upright. So if you have muscles on one side that are tighter than the other side, that's going to pull and cause you to bend over to one side. And so a lot of times we have to figure out why one side is not working as well as the other side. And in applied kinesiology, which is what all the doctors of chiropractic at the office practice, is we muscle test to identify which side is weaker, and also to help us identify things that might support that, whether it's a nerve impingement that's causing decreased communication, whether it's a nutritional deficiency, whether it's an acupuncture energy deficiency, or whether there's a lot of different reasons that can cause a muscle to not work as well. And so we have to identify that, help strengthen it. And there's also exercises you can do to strengthen one side or the other to help your spine straighten out there. The other thing that we see is there are correlations between organ systems and the nervous system. And I know that you see a lot of this with acupuncture. There's major correlations between organ systems, energy flow, muscles, things like that. And so in applied kinesiology and with chiropractic, there's when the nerves pass from the spine, they also go to organs. And so if organ systems are not working properly, it can manifest itself sometimes as pain in different parts of the body, or it can manifest itself as weaknesses in different muscles. And so there's you got to look at the whole body together to figure out, well, why is one side stronger than the other? Why are they being pulled to one side?
Yeah, and absolutely. Like we were talking just yesterday, I mean, Dr. Adams got to work on me because I have a slight curvature in my upper spine, in my thoracic spine, and went to the gym and pulled a muscle doing a sit-up probably improperly. And we know that the one side that's probably firing and giving me discomfort is probably because that curvature is just kind of aggravating that one side, and there's a weak side and a strong side. So got all taped up and feeling better. Thank you, Dr. Adams.
You're welcome.
So we know that physical trauma and working with the muscles. Let's look a little bit more into how you were talking about the connections with the organ system. And in Chinese medicine, the urinary bladder meridian basically is along what we call the paraspinal muscles, which are these ones that basically attach to every single one of the vertebrae. And that does go to affect different organ systems. They're called back shoe points, which are very effective. And just like we took our caller earlier talking about the lower and the lumbar spine, how those nerves there go out to the reproductive system on men and women as well, too. You brought up something interesting about the digestive tract and how curvatures and improper nervous system signals to those organ systems can also be related to the spine.
Yeah, I've had patients who come in with lower back pain, and when I'm doing testing, the muscles around their legs and their pelvis are not firing very well. And what I discovered in case history and the muscle testing is that they have some digestive issues that because those areas and those nerves correlate with the muscles in the lower legs, those muscles are not able to fire or stabilize because of their digestive problems. And they've been adjusted, and the nervous system has been opened up and released, but they're still not getting very good firing in there, and that's related to digestive problems. Now, at the same time, there's even a case study out there where they worked with a young girl who had scoliosis through chiropractic. They just did it twice a week for a while. They noticed an improvement in curve, and in the conclusion of the study, they also made a comment, which wasn't part of the study, that her ability to have regular bowel movements improved because she was having problems before. And I found that interesting that they put that in there, because if you have a scoliosis and the curvature is causing irritation to the nerves that are coming out of the spine, well, now you're not going to get communication to those organs as well. So once they started to correct her spine and she started to have a lower level of pain and started to get better communication with the nerves, she got communication going to the intestinal tract and was able to release her bowels more normally. There's a lot of people probably listening going, I wish I could release my bowels a little bit better too.
That's a whole nother lecture.
Yeah, it is, which we've done before. You could probably find on our YouTube channel, Dr. Tom Roselle Live as well.
There you go. We'll get everyone back in here, all the old lectures.
That's right.
But I mean, we talked numerous times and many different topics where we talked about the importance of not only the nervous system and its firing properly, but also the digestive tract and how that affects inflammation in the body and how that affects basically our healing response. So, even not just for digestive function, the way we think about it, the whole body needs the digestive tract to heal properly as well.
Yeah, I like how you talk about inflammation, because inflammation our body has to do a lot to decrease it and bring it down. And inflammation causes higher acidity in our system, and our body has to buffer that so we don't become too acidic. And calcium is a big part of that. As you get older and we start to lose calcium, especially if you got inflammation, you lose it at a really high level and start to get osteoporosis. Well, if you have too much pressure on the spine on one side from scoliosis, and now you've got osteoporosis on top of that, what happens is you start having small fractures take place in the spine, and that causes major problems because now you get massively increased curvature in there. It gets very difficult to work with because of those fractures.
And I would imagine, too, if the spine's not as mobile as it could be, or there is an exaggeration of a curvature, I mean, you could have issues with everything from cardiovascular issues to breathing just because the ribs can't open the way that they want. You can't move the way you want to move to. Even the bracing that they used before, it was interesting. I saw something where they were going back and forth on whether it was the best technique, because if you're trying to get something to move, do you brace something just to keep it into place? So a lot of things come into factor when you're treating, a slight curvature or something more severe.
Yeah, definitely. That's a good point. Whenever you have something immobilized completely, one, the muscles around it don't get to work as much, and so they're not able to support it as well. And two, when it comes to spine, if a joint is not moving, it's the old, use it or lose it thing. So if the joint's not moving, the body eventually will start to calcify over it, and you can actually get calcification around the ligaments around it too. So now you lose major mobility in the spine, and eventually, your body's going to start to deteriorate. So again, that's why we want to catch it early. But like you're right, when it comes to the digestive tract and the rest of the body, you have to make sure that's working so you don't have other degeneration and other problems down the road.
Yeah, so really when we talk about scoliosis and we're thinking of those curvatures of the spine in our mind, it's affecting the whole system.
Yeah, it's affecting digestive tract. Also, it's with the neck, we were discussing that earlier. We can have injuries, or we can do things that cause us to have our head be tilted a little bit or our neck tilted. And so your body neurologically likes to have your eyes level. And most of us like to stand up straight, so we don't want to have our heads cocked to the side. And so it'll figure out how to keep your head up straight. And by doing so, it adapts. So if your head is tilted to the right a little bit because your neck is tighter on one side or you've injured it, your body's going to figure out how to get your hips or the rest of your body to shift so now your head is level. And so that shifting that takes place means that you're going to have extra curves start to accumulate. So if you start having an accumulation of curves in your neck, eventually your lower back's going to get extra sideways curves, or vice versa. And
the body almost starts to think that's the new normal.
Yeah.
In that curved position. So we kind of deal with it because we've gotten used to it, but it's not anything near where we want it to be, not optimal.
Definitely.
We're going to take another call. Barbara from Silver Springs, how are you doing today?
Hi. I don't know. It sounds like it might be scoliosis or not. How is it that older people, taller usually, are bent over when, as they get older, they cannot stand up straight? What is it that causes that in the body?
That is
And also, how do you think you could help to correct that possibly?
Okay, so that's a very good question. That what we call that, because scoliosis is a sideways curve. That curve on the upper back is called a kyphosis when it's curving forward. We also have what we call lordosis, which is like your lower back curve. And so what happens over time is if we are not, well, there's a couple things that can happen. One, if we're not really working towards standing up straight and working the muscles in the back of the neck and your back to hold that up, eventually we're going to slump forward farther and farther and farther. And that's one issue. Another issue we're seeing now is it's not just older people getting this, but younger people too, because we're looking down at computers and phones and things like that all day. So our head's down all the time. And again, if you start to lose your curve and your head's down, your body's going to say, well, I don't want my head down, I want my head up. So then your whole neck and back come down from looking at computers all day, but then your head comes up and it causes a big curve right there. And then another thing that can take place, particularly with older people, is again, when we talked about some of the degeneration of joints, particularly of the spine, where you get osteoporosis, you can get microfractures in there, which take place, and you can develop a hump on the back like that. So a lot of it's postural because we're losing the battle to gravity over time. Now, when it comes to correcting that, that's the second part of your question.
Yes.
When it gets to a certain point, you're not necessarily going to correct it all the way back. It's not possible. But what you do is you provide motion back into the spine. Now, you can improve the curve a little bit, but the biggest part at that point, in my opinion, is making sure that the joints can start moving a little bit again. Because when they start moving, now you decrease the inflammation that builds up from them being stuck, and you can open up the canal so the nerves can pass through. So now all those tight muscles and pain you're getting starts to decrease because the nerves don't have so much pressure.
What do you think would be the best simple exercises to start doing anyway?
With that?
Yes.
Best simple exercises. That's I don't know if I can give an exact exercise. I mean, just working the back of the neck and your arms. I mean, somebody, I don't know where your particular place is at, but somebody who just lays on their stomach and lifts their head up and their arms up off the floor like Superman, that's a very simple exercise you can try to do to work those muscles. There's other more sophisticated ones that I could talk about with you another time if you want to give me a call or send an email to the office and we can discuss that. I'd be happy to do that.
Like a simple exercise does sound simple, but may not be so simple depending
on
the
and most of them are simple, but they're very effective. So I could give you some more. Why don't you give us a call at the office or send me an email at rosellecare@gmail.com, I think is the email address that we're using. So you can contact us there, or actually on the website at rosellecare.com. There's a section where you can get on and send an email in, and that way we can get back to you if we have, and I can answer some more of those questions.
Okay, thank you, Barbara, for calling in. It's good that you go over the other types of bends and ladder curvatures that also happen. And like I said, those ones are the ones that typically tend to be the ones that develop later on in life, so that wear and tear in the environment has kind of gotten the best of us, or our proper posture has not been in place.
Well, yeah, and even with a sideways curve like that, I usually find in the lower back, especially when I look at an X-ray and their curve from front to back is very much curving to the side. When you look from the side, they're actually starting to lose the curve and it's getting straight. So you get two things happening at once.
I think what the important thing, especially with the exercise component, is just the movement in general. If we're not moving, we get that use it and lose it. But we also see so many other things that are involved when we're inactive, whether it's, weight gain, or we also see that the muscles start working in atrophy as well, too. So we have to keep everything moving, not only around the areas where these curvature issues are, but the whole body as well, too.
Yes.
We're going to be back in just a couple of seconds. You are listening to the Dr. Tom Roselle Live Show.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
105.9 FM and AM 630 WMAL.
And welcome back to Dr. Roselle Live. We are in studio today, and we are 1 week away from Ageless Health 2015, the brain-body connection. we're hoping to see you there. You get to hear us every single week, but we want to see you there and see if we can make some changes. And we're going to talk about everything from the digestive tract to the nervous system to the acupuncture meridians to alkalinization of the body to the gut again. Probably all leads right back to that. And we're going to be there ourselves. Dr. Roselle is going to be there, and we hope you're going to be there too. If you're ready to sign up for that, you got 1 week left. You can either call the office while you're signing up for Dr. Adams' lecture, and that's going to be 703-698-7117. It's an all-day opportunity. We can provide lunch as well too. Or you can go online to rosellecare.com, ROSELLECARE.com.
Nice.
I know.
That's hard to do.
I know. But, so Dr. Adams, tell us what you're going to be going over on your lecture on Wednesday.
Basically going over all things scoliosis. And I like to talk about the what, why, and what do I do about it from a different approach. How do we deal with it without surgery? How do we deal with it without having to wear braces? And if we have had those things, and if we're doing those things, what can we do to support that so that it has it's as effective as it should be, whether that's working together with somebody who's already had surgery or working with somebody to keep them from having surgery. And so what the kind of things that we do in the office, the kind of things that someone can do at home, the kind of nutrition things that they should look at, and then being aware of their body to catch things early so it doesn't become a major problem.
So we know that with scoliosis, it's typically caught as an adult because they're screening more for it. You're finding it, I think it's believed 2 to 3% of American adolescents are diagnosed with scoliosis between the ages of 10 and 16. But the adults later on, even if you were never diagnosed, there may be curvatures in there that are affecting your overall health as well too. So we want to make sure we're getting not only the people that have and know they've been diagnosed with scoliosis, but the people that are even worried about what's going on with their spines.
Yeah, and those are only diagnosed people with scoliosis. Exactly. That's not all the people that have a small curve that I get x-rays and they never knew they had one and I find it and trying to keep that from getting worse. So there's a lot more people that have a sideways curve in their spine than they realize. And so it wouldn't necessarily be clinical scoliosis, but they have a left or right side curve. So in a sense they do, and they just don't know it.
All right, we're going to take one more call. Susan from Chevy Chase.
Oh, thank you. All right. I have my right leg maybe about a half an inch longer than the other one, and I could see that my right hip is higher. And I believe it's affecting my knee because I've had a lot of problems with my knee. Now, I'm asking, too, somebody suggested that I put a heel cushion in the right shoe.
Yeah, it depends. That can be helpful if your leg is actually shorter. A lot of times people think their leg is shorter, but it's really their pelvis is rotated, and so when they lay down or sit down, it looks like it's shorter. And so you have to do a measurement to identify that. What I find is if someone actually has a shorter leg, they were born like that, a heel lift can be helpful, but a lot of times it's due to something not positioned right in the pelvis, and doing some corrections to put the pelvis in the right place actually gets the legs to even out, and that does the most help. So a heel lift could help with the symptoms like that, but it would be good to find out exactly, is your actual legs shorter, or does it just look shorter and it's actually your pelvis out of alignment? Does that make sense?
I was diagnosed with that.
You were diagnosed with one leg actually shorter than the other one?
Yes, as a child.
Okay. If that's the case, then yes, a heel lift would be beneficial because you want to make sure that you're walking evenly on both feet. If not, your body's going to continue to slouch to one side every time you step. So that would be beneficial for someone like yourself when it comes to scoliosis. But at the same time, you got to look and see what's going on with the rest of the body, like we were discussing. But the short answer is probably yes, that would help.
Thank you, Susan, for calling in. It's a good way to kind of wrap things up and basically kind of say, looking at the overall spine can affect multiple parts of the body, whether it's the hips and the shoulders or the all the way down to the feet too. So that's going to be the topic for this Wednesday's night lecture, scoliosis and the natural approaches to its treatment. You can hear all the details. So if you know someone who has scoliosis or you've been diagnosed with it, or if you want to find out more information just in general about the Roselle Center for Healing and hear us speak, feel free to call the office, 703-698-7117, and sign up for your appointment, and also come in and see Dr. Adams. And we are hoping to see you also at Ageless Health next Saturday afternoon at the Fairview Park Marriott in Falls Church. We'll see you there, and Dr. Roselle will be back next week. Thank you.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.